While hand washing may be the simplest way to control infection, it is often not practiced correctly. The purpose of surgical hand scrub is to remove debris and transient microorganisms from the nails, hands, and forearms, reduce the resident microbial count to a minimum, and inhibit rapid rebound growth of microorganisms. Remember some basics regarding shoes and clothing. Street shoes not allowed. Closed-toed shoes are required. Shoe covers are for single use only. Must wear scrub attire, a cap and mask in the OR at all times. A surgical cap should cover the hair completely. A face mask should cover the nose and mouth completely. Now we will look at surgical scrub technique in more detail, as all sterile team members should perform the hand and arm scrub before entering the surgical suite. The basic principle of the scrub is to wash the hands thoroughly and then to wash from a clean area, the hand, to a less clean area, the arm. A systematic approach to the scrub is an efficient way to ensure proper technique. There are two methods of scrub procedure. One is a numbered stroke method, in which a certain number of brush strokes are designated for each finger, palm, back of hand, and arm. The alternative method is the time scrub, and each scrub should last for 6 minutes. The procedure for the 6-minute scrub consists of removing all jewelry, rings, watches, bracelets, etc. Wash hands and arms with antimicrobial soap using warm water. Clean subungual areas with a nail file. Start timing. Start by lathering the scrub brush quickly on both hands and arms to allow soap to have greater contact time with skin. Scrub each side of each finger, between the fingers, and the back and front of the hand for 2 minutes. Proceed to scrub the arms, keeping the hand higher than the arm at all times. This prevents bacteria-laden soap and water from contaminating the hand. Wash each side of the arm to 3 inches above the elbow for 1 minute. Repeat the process on the other hand and arm, keeping hands above elbows at all times. If the hand touches anything except the brush at any time, the scrub must be lengthened by 1 minute for the area that has been contaminated. Rinse hands and arms by passing them through the water in one direction only, from fingertips to elbow. Do not move the arm back and forth through the water. Proceed to the operating room suite, holding hands above elbows. Once in the operating room suite, hands and arms should be dried using a sterile towel and aseptic technique. You are now ready to have the scrub tech don your gown and sterile gloves.
No matter what agent is used or which scrub technique you practice, there is only one goal: infection prevention. Effective surgical scrubs are one of the most powerful strategies of infection prevention in the OR. Glove usage gives a false sense of security against bacteria. Gloves provide an ideal environment for bacterial growth, moisture, and warmth, which makes good hand scrub techniques and aseptic gowning and gloving an important part of the total infection prevention process. Now we will show you some examples of what not to do. Do not walk into the OR without a mask on. Do not walk into the OR with a white coat on. Do not wipe your hands off after you're finished scrubbing. Do not touch the OR doors or any other non-sterile area after scrubbing.